Having a baby on the way is an exciting time, but it's also stressful. Add in the possibility of complications, and anxiety can go through the roof. When you think of complications that can happen, you might think of things that can go wrong at the beginning or end of a pregnancy. However, it's best to break them down by the three main parts of a pregnancy: the first, second, and third trimester. The first trimester of pregnancy can be a time of major adjustment for many people. Your body starts to go through small changes, while your mind wraps around the idea of parenthood. In those first 14 weeks, there are several complications that can happen. Some of these can be more severe, like having a pregnancy that develops in the wrong place, or one that ends early, called a miscarriage. Sometimes a complication can be a symptom that's more severe than expected. Nausea is a common symptom that many women experience during the first trimester. But nausea can be more than an upset stomach. It can pair with vomiting, and this can make it tough to keep down food or water. One of the concerns with severe nausea is dehydration. If your nausea is so severe that you have trouble keeping down food or liquids, it's time to seek help. You might hear people say that the second trimester is the best part of pregnancy. For many people, this is the time when the bothersome symptoms of the first few weeks are a thing of the past, and the discomforts of the third trimester are a distant worry. One of the big moments of the second trimester is the anatomy scan. This is an imaging test where your healthcare provider will look at your baby and check the development so far. Many people decide to learn their baby's sex during this appointment. The majority of the time, we can identify the sex, but keep in mind that there may be reasons it can't, or it's misidentified. Most of the time, this is a joyful and happy experience as you look at your baby. But sometimes, the provider doing your scan sees an issue. Possible birth defects can be discovered during this second trimester ultrasound. You might hear the phrase structural abnormality, which means that something doesn't look as it typically would. It can be scary to see something like this on an ultrasound. But if this happens, your provider will talk you through each step of the issue and help you develop a plan. When you enter the third trimester, you're in the home stretch. It's almost time to meet your baby, but on the way to that, there are still several complications that can happen. Preterm delivery is one of them. That's when your baby is born before it's ready. A baby can be ready to be born anywhere from 37 to 42 weeks. Any earlier, and risks of complications increase. During the final weeks of pregnancy, you can also develop certain medical conditions. One thing that can happen is your blood pressure can rise. High blood pressure during pregnancy is something that your provider will monitor carefully throughout your entire pregnancy. If it goes up significantly, you can develop a condition called preeclampsia. When you have preeclampsia, your blood pressure is higher than 140/90. You might experience symptoms like headaches, blurry vision, puffiness in your hands and face, and shortness of breath. Preeclampsia is a dangerous condition that requires evaluation by your healthcare provider. If you're experiencing any of the symptoms of preeclampsia, it's important to contact your provider. A lot can happen throughout pregnancy. Your body is actively changing as your baby grows and develops. Because there's always a chance that a complication can happen, it's important to find a healthcare provider you trust. As a team, you can face any issue that comes up.